Joining me today, and I'm really excited to share this really personal journey of mine about how I started off on a project that was focused on understanding genetic risk and how that kind of transformed into my own personal journey with cancer screening and my own genetic risk. So, just a quick little intro about me. My name is Abby Olivier. I am based in Brooklyn. I am a senior product designer at Memorial Sloan Kettering Cancer Center. Before that, I worked in design consulting for several years and got to dabble in a few different industries, but I've really only been in healthcare now for only 4 years. So I still have a lot to learn. It's a very complex system and plenty of different things to learn. And in general, I think I have a passion specifically like with healthcare of turning complex information into clear, actionable guidance, I would say. Like that's like one area specifically like I am passionate about, especially in high stakes situations. So hence why I'm at MSK. Okay, so starting off, I was put on this project, and how my story is going to go today. I'm going to walk you through just that project a little bit and really talk about how my own personal kind of curiosity and just wanting to do my own research about genetic risk kind of took me on this journey and to experiencing what is it like to have genetic counseling firsthand. Um, so I'm going to go a little bit past this just for sake. Um, so in general, I was placed on a project, and the program was called Guided Risk Management, and it was meant to be a pilot program for patients who had encountered genetic counseling. So really, the point of the program was to not only get them engaged with genetic counseling, but to explore what does it look like to really support these patients after they've had that initial genetic test, and if they have any specific screening recommendations, how can we support them more long term in terms of their monitoring and remembering to, schedule screenings, um, just make healthier life choices, things like that. So it was a little tricky because the real challenge there is you want to be able to provide support, but also you want to motivate patients to take action without overwhelming them. And some of this like genetic information and what does it mean for my risk and etc. can create a lot of emotions and can also be very clinical, right? So we had a challenge to really balance the clinical accuracy of communicating their risk and what it really means, but also wanted to provide the emotional support and the motivational support. So this is just a really brief example, but of the program and the digital sort of support offerings we explored. In general, I think we went down a path of exploring just how can we better communicate what genetic testing is about, what it really does tell you versus doesn't tell you. If you do have a genetic mutation that, you know, like for example, if I had BRCA1, it doesn't necessarily mean, you're going to get that cancer. It's simply a risk equation, but that is all very technical. So how can we put that in such a way that's meaningful to people and digestible in a way that that doesn't alarm them? So, but in general, our program identified any of their known genetic mutations. It shared their risk score and our general recommendations for them based on that risk score. We put together a screening plan with friendly language and really developed tailored goals for them and gave them tools to monitor those goals. And then we also, like I said, provided just ongoing guidance, tried to update content. They also had opportunities to potentially join in research and find out about potential up and coming research on genetic mutations, because that's kind of the thing people don't always understand. When you do genetic testing, it's not always like a one and done situation. Um, Research is always evolving. We're always uncovering, more mutations. And so just because you were tested once like 10 years ago doesn't necessarily mean that you wouldn't test positive for something that since has been marked, as a mutation that's indicative of higher cancer risk. So that, in a nutshell, was the program and the project that I was focused on. And before we even started building any sort of digital tool to, support um, patients, we really also wanted to hear from, there was a set of designers who came before us on this project who had done a lot of research and had done a lot of interviews with patients. And they shared with us some of the major things that they heard, which, I don't think we were surprised by, but that was kind of our starting place. So, for example, like I just said, a lot of confusion, right, around these terms like BRCA, BRCA1, BRCA2, or there's a much longer list of mutations of terms, and variants of uncertain significance versus like positive, negative. A lot of this language was very, while clinically accurate, it didn't really leave patients with a sense of like true understanding. Like they would understand maybe as their counselor was explaining to them, but then later when they went home, they didn't necessarily remember all of that. And when they referred back to any documentation, it wasn't always easy for them to interpret on their own. I think we also heard that there was a lot of decision fatigue. So even when you have learned, like, okay, I have tested, say, positive for a certain mutation, there is a list of all of these screening recommendations potentially. And in some cases, it might be overwhelming. It might be a lot of different options. And also, some of the options might sound similar, and, it's unclear even differences sometimes between them. So I think there was an observation that sometimes that, I guess, really just load of information caused overwhelm and paralysis. People didn't always really know where to start. And then the emotional burden, I think anytime you talk about cancer risk, that tends to be very triggering for people. A lot of people have their own emotional stories that are closely paired with some form of cancer, right? So even hearing that, like, oh my gosh, I might be in a high risk population, I tested positive for a mutation, really trigger a lot of um, anxiety and fear that could cloud people's experience and understanding even of what to do next. And then also, I think there was a desire communicated uh, that there was a want of to have ongoing support. So that was kind of why we were exploring this extended program that was after the fact, after that kind of initial genetic testing and counseling interaction, but really trying to go on the journey with them longer term. So that was part of why we were exploring that. So now, where does my story come into play in this? So as a designer, I usually like to lead as much as possible with research, and I think some of these genetic testing programs, it's not it's not the same as doing desk research, I guess, for other designs. Like, we were engaging with a program and what it was like to go through a program. So I personally was curious about it and decided, well, I guess one of the best ways to do research is just do it myself and go try genetic counseling on my own. Um, so I did that. I wanted to get some firsthand experience and see what it was like when you are in the patient seat. Um, and through that process, I also started to reflect on my own family history. We do have a strong history of breast cancer that I knew about. I had lost an aunt that I was very, very close with back in 2015. And so that was something I knew about and I'm aware of. I knew my mom's mom also died of breast cancer. So I thought, I know this history, but I think I know it pretty well. But, maybe that's even another reason I should go this path and try this out for myself. So I did. So I was like, okay, let's do it. That all sounds great. Um, so from there, um, like I said, I knew the family lore, I guess, of our unfortunate history with breast cancer, but I did want to sit down with my mom and a couple of other family members and start to have more concrete conversations because as I was filling out things to engage with the genetic counselor, I started to realize, oh, I need more specifics. Like I need to know how old was this person when they were diagnosed? I don't really remember, things like that. So I did start to have conversations with a couple of family members to really just understand what is my family health history in regards to cancer. I think I really learned more. I learned really that like, oh, I don't actually know as much as I think I do, and I haven't really asked these questions before. And I also went ahead and also asked on my dad's side of the family as well, because I had always heard about breast cancer on my maternal side, but I hadn't even thought to even ask about my dad's side. I hadn't heard of anything, but I just didn't know. So that process was interesting. I think it's always hard to ask difficult and specific questions. Sometimes it requires sensitivity. It's a touchy subject in my family. We all love my Aunt Paula a lot, and it makes people sad sometimes to think on those things. Some people are more willing to talk about those things than other family members, and you kind of, I had to gauge that. And I think the other tricky part that I learned was that it's very hard to even start to craft a medical history of your family because especially as you get into like later generations, like my grandma for example, who um, also passed the breast cancer, we weren't even at the point where we understood certain types of breast cancer at that point in time. So there's just certain gaps that are going to happen no matter what. And I think it also just depends on your family and how well people keep track of things. Um, and my family didn't really keep track of that much. My mom had things in her head, but nothing is like written down. So that was something that I like took it upon myself to really try and do. I'm like, okay, I'm gathering all this information. I want to like document it at least for myself, for my future, generations potentially down the line, and then also yeah, for mostly also for myself because I will forget and I need to just like keep track of these things. Um, the other thing, like I said, I did learn actually a lot of things that I thought I knew so much about my history, my family history, but I actually learned of even more breast cancer in my family tree than I originally knew. So my aunt's diagnosis, obviously, I was alive for and I experienced firsthand. So that one, of course, I knew a lot about it. I knew it was triple negative breast cancer, which is a very aggressive breast cancer. But then with my mom's mom, I knew that she died when my mom was really, really young. Um, and I knew it was breast cancer. That's pretty much all I knew. But after talking with my mom more, I uncovered like, oh, no, she actually also was diagnosed at 45, which in the breast cancer world is considered early onset. Um, So that was kind of a discovery. And then I also learned that my mom's mom also had breast cancer, had passed of breast cancer, which that I had absolutely never heard of. So that was pretty surprising to me. So all of these kind of discoveries really had me reconsidering my risk, I would say. I think I knew that breast cancer was in my family, and I was always a little concerned about it, but I just kind of shrugged it off. And after kind of learning, like, oh, it goes like this many generations back, I think I started to really see a pattern also in like the early onset part of it, at least from what I knew with my aunt and my grandma. So, just for some context, a little bit here. So, I didn't know my great grandmother's age when she was diagnosed, but both my grandmother and my aunt compared, less so my aunt, compared to the average woman, um, were diagnosed at younger ages. So, that is like a remarkable thing that I kind of like uncovered and would eventually discuss with the genetic counselor. So the average US woman age of diagnosis is 62. My aunt was diagnosed at, it was 58. And then my grandmother was 45. So this is really important. And I think it's something that, like I said, not all families are good at. And I learned mine is not. Uh, and I think it's really important, and it's something we need to normalize talking about and finding other ways to talk about and having open conversation about of just your family health history. It doesn't have to be cancer; it could be anything really. Um, but it does really matter because 5 to 10% percentage of breast cancers are hereditary, and also specifically like if you are a carrier of a genetic like something like BRCA, in this case BRCA, your risk goes up exponentially. Um, and then also it really matters because if you do have some elevated risk for whatever reason, there's several reasons your risk profile could be heightened, but it matters because you start screening much earlier, and you should start screening much earlier. And that can really make a huge impact on how and when you're able to potentially detect something. So from that point, I was done talking with all of my family members, and I started on the actual journey of the counseling. So I was able to find a counseling service that looked really great, did my initial assessment, um, filled out all the information that I had received from my family, sent it over. And then we had our first session, which was a virtual session. And in that session, I think we went through all my options, different recommendations for me based on my risk. And then by the end of that session, I think I had already done like a little pre-risk assessment quiz beforehand. And so I think going into the appointment, my counselor already knew that I was probably, it was definitely high risk enough to suggest genetic testing and go through with it. And so it was up to me also to decide the different options for testing, which there are more than one. So the different options I was weighing were either saliva or blood. I chose the blood sample because I just was nervous that I would mess up a saliva sample and mailing that in for some reason. So that's what I did. The other thing also that we did go over in my counseling appointment was just what it means to be at risk. It's not like a guaranteed thing. It doesn't mean you're going to get cancer by any means. But it just is additional information that can help you take more proactive action and understand what that means for you. So, the other really cool thing that I wanted to share about this process and the blood option that I chose, which was really a big delighter, I would say, in my experience, So I chose doing a blood draw, and they actually came in like a little van or truck thing to my apartment in Brooklyn to draw the blood from me in my own home, like from the comfort of my own home, which is pretty insane to me. I mean, I know that I live in New York City and there's, lots of access here sometimes, but it was still pretty mind blowing to me. And I didn't have to pay any extra charge for any of this. It was all covered. Um, so that was probably like the best healthcare I've ever received, literally at my front door. And it was kind of inspiring because I am obviously someone who is younger and can I could have gone to like a Quest Diagnostics or something easily, but like seeing services like that offered was pretty exciting because I was like, wow, this could be really game changing for people who aren't as willing to go out of their way to do screening or even like sample options. So it was just a cool experience to see that. I was like, wow, this is amazing. So after the blood draw happens on my couch, um, the way it works is they take your sample. There is a genetic analysis period where they analyze. I was analyzed for 36 genes. There's other tests that sometimes do more or less. And then based on all of the genes that they are analyzing, you will get results back. Um, and like technically, you could get these results for each gene, but um, usually like they'll just basically tell you individually like if you have one, or if you have all negative, for example, they'll just give you one negative result type. And then the waiting period was about 2 to 3 weeks for results, and then I had a follow-up counseling session to review my findings. So overall my test results were negative, um, which I was not surprised by because I had heard, I wasn't sure if my aunt had gotten tested for BRCA previously, which is why I went ahead and did this because I just wasn't positive. That I had heard that she was negative for BRCA. Um, so I wasn't surprised, but it was still like nice to hear, like, cool, great, negative. Um, but one thing that I we talked about in our follow-up session, like me and the counselor, she did tell me that she recommended other screening options for me. Um, but I don't think I paid close enough attention, I guess, because I just thought, okay, cool, yeah, I should start doing my mammograms like every year now. So my risk score was high enough to where she was like, okay, you're not 40, which is like the average. That's the general recommended screening age for mammograms. Um, so I was supposed to start sooner just due to my family history. And then also, I think future guidance, she wanted me to stay in touch just in case there's any new mutations in the future. Like I mentioned before, it's an evolving process always. So you kind of it's good to stay in the loop a little bit, because just because you've tested negative once doesn't mean new research might reveal there is a future mutation that has a connection to breast cancer. But in general, I was like, okay, cool, negative result, great, I'll start getting mammograms, that I can do that. And I was honestly relieved to have like a plan of action. um Really quick, I'm going to go through high level what is this genetic risk scoring that I'm alluding to. So it's basically a numerical value that is used to estimate your probability of developing cancer. And this number is calculated by using an array of different factors, such as your current age, your family history, your like whether you've had children yet or not, and of course your genetic markers. So my risk score was 21.2. That's my lifetime risk, calculated risk of developing breast cancer. Now, every average woman's average risk is 12.5. So I am a little bit more elevated. And then the threshold that they use to say, like, whether you're kind of in this higher risk category is 20%. So if you're over 20%. So I was just barely over 20%. But because I was, I actually, what I learned later, had more extended recommendations than just the mammogram. I learned this kind of 6 months after. I realized, oh, I should like read the results a little more closely. I don't remember what triggered that, but I happened to go back and look and realize, oh, I missed this like MRI thing, and I don't remember talking about that as much during our counseling session. So in general, recommendations are if you're under the age of 40, you should do monthly self exams always to familiarize yourself, with how to do an exam, to understand your own, body and what's normal, what's not normal. And then, of course, a yearly clinical breast exam is always recommended. That just means when you go to maybe your PCP or maybe your gynecologist, they will usually at your annual appointment, offer to do a clinical breast exam and check for any suspicious lumps or things like that. But then mammograms don't start until you're 40. So for me, my recommendations change. Still want to do self exams, clinical breast exams, mammograms. But then I also saw, it's recommended I get yearly breast MRIs with contrast. So that was kind of new to me, and I hadn't really heard as much about that. So beyond mammograms, which is what I think most people think of when they think of breast cancer screening, there's actually a few other options as well. So mammogram, of course, first and foremost, gives you an x-ray of your breast tissue. An ultrasound is even more specific. It's supplemental to a mammogram and kind of gives you more detailed pictures, and it's specifically helpful if you have dense breast tissue, which can sometimes things will not show up on a mammogram if you have denser breasts. And then there's the breast MRI, which is the most comprehensive and most sensitive for detecting cancer, also particularly in dense breast tissue. So I didn't even know about all of these other options, or these two other options, I guess. So that was kind of enlightening for me. And I also was kind of like, why? I feel like maybe that should have been emphasized more. Like the counselor was great and everything, but I think maybe she did talk about it, but it's a good example of so much was going on and I was learning so much information that I, for whatever reason, didn't pick up on that piece, or it didn't compute to long-term memory at least. But yeah, so one thing to call out here is, screening is not one size fits all. This is another reason why genetic counseling can be so valuable, because, you can learn these things and uncover, there's actually, other options if you are a certain risk range, and it makes a difference. And I think really quick, why is screening so important? I think especially with most cancers, but definitely breast cancer, early detection makes all the difference. So the earlier, of course, you can detect cancer, the better, and you have a much higher survival rates. And especially if you are high risk, it's great to kind of get ahead of that. And not only that, it also minimizes the need for more aggressive or invasive treatments. So the earlier you detect as well, usually results in you can take a more minor approach. So for example, having just a tumor removed, a lumpectomy versus a mastectomy, which is removing the entire breast. So finding out things earlier if you do have something is very impactful. And then not only that, it also gives people a peace of mind. So being able to do something proactively and taking action on something and feeling like, okay, I have this yearly, I'm worried about my family history of breast cancer, but I have this yearly appointment on my radar always, that at least I have that, right? That can help people feel a bit more in control over something that's, really beyond your control, right? So after I kind of went through this experience, I was reflecting a little bit on some of the barriers I experienced. And I think one of the things that even today I still get a little confused on is clinical language. I think oftentimes, like even in my appointment with my counselor, who's very, great, great bedside manner and communicated things really well, but still, even so, like sometimes the medical terminology can kind of create unintentional confusion. Um, so I think even my example there of like not like remembering the MRI stuff, I think was likely because I was just focused on learning like some of the things that my counselor was explaining to me that I kind of missed, like that critical piece of information. I think that's really important to call out. The other thing that I did notice as well was that while I got recommendations, I didn't really get any direct referrals or actions to set up any screening sort of appointments. And that was like a huge missed opportunity and just a huge, I think, problem if it's happening. I assumed it was happening probably elsewhere. Um, because I'll tell you what happened. I meant to get my annual mammograms and MRI appointments on the calendar, and what happened was it didn't actually happen until like the next year. So having like an actionable, like here's a doctor you can speak with, or here is a place I recommend at least even for a mammogram, et cetera, can make all the difference. And that was something that I didn't really experience and was a huge gap. And then the emotional support, of course, like I said, I think a lot of it was very focused on like data, not as much on like how are you feeling about this or setting me up to take action. And I think when I sat and thought about this, I think in general, like this really kind of helped shape my mind around this project I was on, because one area that our project ended up digging into pretty deeply was like the importance of language and how um, literacy matters, and we shouldn't assume everyone is at the same level. And the easier to understand you can make something, the better. So that was like a really big theme on our project, I would say. And I think also just it was interesting to have lived the experience, right? Like I'm designing for people who have gone through this. I have not gone through this. That's always very informative. And then also timing is everything. So even back to the example of the MRI information, right? Like I wasn't ready to take in all the information at that appointment. Clearly, I wasn't able to. So how can we find better ways to deliver information um, in a timely way to also account for like the time it takes a patient to process things? It doesn't have to always be all at once. It can be all at once, but like, can we have some follow-ups as well to kind of reinforce some of that information? And then, of course, empathy with the design, like needing to acknowledge and address all of these emotional states and feelings of going through this process, because, it's a lot. It's a lot to talk to your family, to rehash some of these, you know, moments of life that have impacted an entire family tree. Sometimes can be tough. And then also even going through it yourself and experiencing fear and just anxious about some of these things. It's important to always acknowledge the feelings of people as they're going through these types of experiences. Some other barriers, like beyond my own, that I also was trying to reflect on going through this project was one that I already talked about a little bit, but family histories and family communication dynamics. Like that can be so different no matter like who you are. Every family operates differently. And some families are really good at documenting their histories. Some really are not. Some don't even think to do it. It's not even that they're bad at it. It's not something that crosses people's minds sometimes. And it really doesn't come up until a crisis happens. So I think, how can we be better as people and just to normalize that, I think, amongst ourselves is like a big learning experience for me that I had from this. Um, Also, there are a lot of just in general missed opportunities. There's so many people who are eligible for screening options that don't even realize it. So just general awareness of screening and how it can be valuable is also like a huge access problem. Um, and then, of course, there's the systemic barriers like insurance coverage, provider awareness, even can vary. And then also just digital experience gaps as well. Like who has access to, information on the internet, for example, versus who doesn't. And how do we kind of bridge some of those gaps? And then, yeah, like really call to action here is we need to have more inclusive proactive systems that are able to reach different types of eligible patients in different ways. That's like one of the biggest, I think, things that I have taken away from this project. So what can good design do? I think I spoke to this a little bit, but clarifying things, trying really hard to simplify results and really make things as plain language as possible. Um, One thing we've also found success with at MSK is like using um, meaningful imagery to communicate medical information sometimes can also really be powerful. And that's something I think we strive to be better at always. Um, I think also empowering people with clear next steps, not just the data, not just saying, this is your statistical percentage, whatever, but like, what can you do about it? And framing things from that way can really change how people think about something and how they, what they even do with that information, right? And then also creating clear pathways of support and resources at different moments in time. So yes, having that appointment where I learn these are my results is very great, but how can we also offer ways to reach people after the fact when they've gone home and thought about it for a month? How can we continue to reach out and bridge that gap and help people continue to act on what they've learned? For sake of time, I'm going to go a little bit forward, but I think in general, the biggest thing that I learned through this, was it really, I think, being able to experience things as the patient and going through this process, I think opened up my mind a little bit more. And I think it's always important to remember that, like, at one point in time, like, we will all be a patient. And I know, like, it's easy to say that, but it really is a different experience when you're going through it yourself sometimes. And I think not taking for granted each interaction and moment in time you ever have to interact with the patient is and the emotional weight that can carry is really, really important, and something I take to heart even more now. And I think also, like, understanding risk is more than just, I mean, it is statistics, but it's also like reality and a lived weight that that carries, that people hold and families hold through generations. And I think it affects people's choices and even how they like to think about a situation. And I think the more we can be clear about what risk actually means and empower people rather than not even intentionally scaring people, but just it being a bit more technical, I guess. That is not the thing I think that like educates people or empowers them to take action about any risk. And then I think also just investing in impactful moments where you can and accomplishing outcomes. I think I like to always point to that the door to blood draw that I had, because I've never had a medical experience like that in my life, at least in the US, and that was pretty exceptional. And I will remember that always. The more we can look for moments like that and invest in those moments for our patients, the more, the bigger difference we'll make. Because I'm here like 3 years later, still talking about that, and it was like amazing to me. So I want to close by sharing a little story. So, like I mentioned, I did take some time to actually get my actual screening appointments scheduled because life got a little busy. It always happens. And then last year, I actually heard a story about the actress Olivia Munn, who had she's in the high risk breast cancer population, and she had just announced that she had breast cancer, and she had removed it successfully already, but she came out with her story about it. And the only way she actually found it was through an MRI imaging. And she had literally just had it like in December, I think. Or sorry, let me back up. She had just had her mammogram in December. And then her doctor saw her risk score was higher and was like, "Oh, actually, you are eligible to do MRIs as well. We should do an MRI." And because her doctor said that, that is how they found it, because it did not show up on the mammogram from December. And in January, they did the MRI. Um, so once I heard that, I was like, I should like get back to scheduling those screenings that I'm supposed to be scheduling. And so I did. That is what I needed to get myself moving and do that. So I did schedule my annual screenings. And I also, it was a good reminder for myself to, okay, Abby, start doing your self exams regularly again. Like, you need to make this a habit. And then later that year in December, when I was doing a self exam, I actually found something that felt like a lump to me, or at least like it wasn't something I was familiar with. So it concerned me. But because I had already, empowered myself by having these regular appointments and habits in place, I was alarmed, but I felt prepared and I knew what to do next. I wouldn't say I was immediately at ease, but I had a game plan, and I knew what to do. I knew who to reach out to immediately. I didn't have to waste time or stress even, figuring things out. Um, and that was kind of amazing that all happened in 1 year for me, because it was like, wow, I'm really glad that I had set that up finally and took action. So I'm just really, the point here is that sharing these stories and talking about these experiences really helps normalize screenings and also helps spread awareness of them and how they can truly be impactful, and it can change people's behavior and ultimately save lives. So I think the biggest thing I want people to know is, advocate for screening. We should be telling these stories, sharing these stories. We all have a story or probably know someone who's had a story with screening and or finding something like this, or have something like this happen in their life, and we should be talking about it and sharing what we've learned. I think documenting family history was like a big takeaway here as well. It's important to understand your family's health history, not just from a cancer perspective, but many other perspectives as well. I learned that my grandma had a heart attack that I had no idea about through this experience as well. So like it's surprising sometimes what you don't know, and it's really important to start to ask those questions and prepare yourself, and not just for you, but for future generations after you, if you choose to have, kids or anything. And then something simple that everyone can do is, if you think you have maybe a certain family history for a certain cancer type, there's so many risk assessment quizzes out there. Before you even get to the counseling step, you can take one of those and they can roughly guess your risk score. Now, it's still always encourage genetic counseling, but there are so many tools out there for people to even start to understand that about themselves. So, definitely encourage everyone today to do that. And then, advocate for screening, of course. It can really save lives. Early detection, especially in breast cancer, can change everything. And of course, thoughtful design, lead with empathy, and always remember we will all be a patient at some point. And I think the more we lead with that, the better. And we need to remember that people are doing their best to navigate a very complex system. And how can we find ways to make even this one small step of it better? That's all I have for today. But thank you again, everyone, for listening.